Libido, also referred to as sex drive, is a person's overall desire for sexual activity. Libido often plays an important part in the formation and maintenance of relationships, and a libido mismatch between the partners will often adversely affect their relationship. Hello everyone, I'm Dr. Anonit Sabharwal. I'm a Delhi-based psychiatrist with a decade-long experience in sexual health, mental health, and addiction. Today I'm going to be talking about libido and how it differs in men and women. So the first question that comes to mind is, why do we have a sex drive at all? You see, libido is an important force in the Darwinian theory of natural selection. Libido's main evolutionary purpose is to get the species to procreate so that there's a higher chance of conception because of increased frequency of sexual intercourse. And because of this evolutionary purpose, women's sex drives are highly fluctuating, with their sex drive being the maximum just before ovulation in each menstrual cycle. Men's sex drive, however, remains relatively stable. Let's now look at the neurobiology of libido. Libido is governed by the mesolimbic dopamine pathway. So what's the mesolimbic pathway? Well, this pathway is also referred to as the reward pathway and is also involved in addiction. Now, this pathway connects an area of the brain known as the ventral tegmental area in the midbrain to another area in the brain called the ventral striatum in the forebrain. Now, ventral striatum includes nucleus accumbens and olfactory tubercle. For simplicity, just remember this. Neurotransmitters, when transmitted through this pathway, give us pleasure, and that facilitates reinforcement, which means that the more we do it, the more we find it pleasurable, and the more we want to keep doing it. Now, in this pathway, dopamine and related trace amines that modulate dopamine transmission play a critical role in regulating libido. Other neurotransmitters, sex hormones, and neuropeptides that regulate libido include testosterone, estrogen, and oxytocin, which are directly correlated, which means the higher the levels, the higher the libido, and progesterone, serotonin, and norepinephrine, which are inversely correlated, which means that the higher the levels, the lower the sex drive. However, keep in mind that all of these substances affect libido to varying degrees, with dopamine and testosterone being the strongest modulators. When it comes to age, a surge in testosterone hits the male at puberty, resulting in a sudden and extreme sex drive, peaking at 15 to 16 years of age and then slowly dropping over the course of his lifetime. In contrast, a female's libido gradually increases during adolescence and peaks in her mid-30s. Like I mentioned before, a woman's sex drive or libido fluctuates within the course of a menstrual cycle. And that is because testosterone levels start rising from the 24th day of a cycle, and then they keep rising till the 14th day of the next cycle, with the 13th day being the day on which the testosterone and estrogen levels are the highest, and that's when the woman wants to engage in sexual activity the most. On the week following ovulation, the testosterone and estrogen levels dip, and also the progesterone levels increase, leading to a lack in the sex drive, and B, difficulty in achieving orgasms. Talking about pregnancy, but in early pregnancy, there's an unusually high levels of estrogen and progesterone, and this leads to symptoms like queasiness, exhaustion, and breast sensitivity, thus lowering sex drive. Around week 10 of pregnancy, both of these levels, they dip, and because of that, it leads to an increase in sex drive and libido. By the third trimester, due to backaches and weight gain and other symptoms related to late pregnancy, the sex drive again dips. During lactation, prolactin levels rise, causing the breasts to start secreting milk. Now, prolactin levels rise and cause dampening of the estrogen levels, and this leads to lowered sex drive. In addition, women who are lactating also have very low levels of testosterone, further decreasing sex drive. Although not an absolute rule, the following are general patterns derived from surveys and studies that make men and women different when it comes to libido. Number 1, men think more about sex. That's right, the majority of men under 60 think about sex at least once a day, with the average being 15 to 20 times a day. For women, the number is half that. As men and women age, they start to think about sex lesser, but men still think about sex at least twice as often as women do. Men also have more spontaneous sexual arousal and more frequent and varied fantasies. Number 2, men seek sex more. Men want sex more often than women at the start of the relationship, in the middle of it, and after many years of it. And this isn't just true for heterosexuals. Studies show that gay men have sex more often than lesbians at all stages of their relationships. Also, men want more sex partners in their lifetimes and are more open to having casual sex. Number 3, men masturbate more. Multiple studies have shown that about 2/3 of men say that they masturbate, even though half of them say they feel guilty about it. In contrast, about 40% of women say they masturbate, but the frequency of masturbation is also lesser in women than it is in men. One study reported that about 58% of males entertain sexual fantasies during masturbation, whereas only 12% of women did the same. Now, women's masturbation involves fantasies of affection and bonding, whereas for men, it involves actual sex. Number 4, men are more promiscuous. Various surveys show that men are more likely than women to seek sex even when it is frowned upon or outlawed. And that's probably why prostitution mostly involves a man seeking a woman for paid sex rather than the other way around. Number 5, women's sexual turn-ons are more complicated than men's. Straight men are turned on by male-female and female-female sex. Gay men are turned on by male-male sex. But for women, things are a little more complicated. Women show the same genital reaction to male-male, male-female, and female-female sex. Now, this is because men are very rigid and specific about who they are sexually turned on by, who they end up having sex with, and also who they fall in love with. In contrast, women may be more open to same-sex relationships thanks to their less directed sex drives. Women have a higher capacity than men to fall in love with their own sex and engage sexually with their own sex. Number 6, women's sex drives are more driven by socio-cultural factors. Women's sexual attitudes, desires, and practices are more likely than men's to depend on their environment. This means that women's sexual attitudes and willingness to perform various sexual acts changes over time. Also, women are more likely than men to be influenced by the attitudes of their peer groups in their decisions about sex. And women with higher education are more likely to have performed a wider variety of sexual acts, such as oral sex, than men's. For men, education does not make a difference. Number 7, women take a less direct route to sexual satisfaction. Now, men and women travel slightly different paths to sexual desire. For men, sex is more simple and straightforward. But that doesn't mean that they don't value intimacy, love, and connection in a relationship just as women do. They just view the role of sex differently. For women, they want to talk first, connect first, and then have sex. For men, sex is the connection. Sex is the language they use to express their tender, loving, and vulnerable side. It is their language of intimacy. And number 8, women's libidos are less likely than men's to respond to drugs. Now, we know that there's a hormonal component for low libido, which is the lack of testosterone, but when we administer testosterone to people with low libidos, men seem to respond much faster and much better than women. Although there is a testosterone patch available for women in Europe, and that's called Intrinsa, FDA has still not approved it in the US because of long-term safety concerns. Now, why women are less affected by testosterone patches than men is still a topic of research. Okay, so this brings me to the end of part 1 of this topic. I'm going to be back with part 2 where I'll discuss the most frequently asked questions about libido. Thank you for watching till the end. Take care of yourselves.